Hi, my name is Ashleigh Johnson. I currently attend James Cook University in Cairns as a first-year honours pharmacy student, and I am applying for the role of the Rural Health Chair. When I'm not studying or at uni, you can find me reading my next favourite book, journaling, or planning another camping trip out in the country. Currently, I'm part of the NAPSA committee as the first-year representative. However, I plan on applying for multiple different committee roles at our next AGM for 2027. As a first-year representative, I am able to attend NAPSA meetings and pass on information to the other first years who might not be aware of what's going on behind the scenes, especially when university is still new and it's difficult enough just trying to find which room my compounding lab has been moved to. I can also create a safe space for these students across all JCU campuses to contact me if they are having issues within the degree or would like something negotiated with the NAPSA committee, but may not feel confident enough to do it themselves. I like to keep up to date with all things current in pharmacy news so I can further educate them on upcoming opportunities. I've also worked in a remote pharmacy on the Atherton Tablelands since I was 15 and am now 20, where I've collaborated with a variety of different people and encountered a vast array of patients that may live locally on a rural station 8 hours away or even overseas. I'm also currently employed as an outreach ambassador at JCU, where our main focus is encouraging rural and remote school-age students to continue their studies into any form of university or higher education. However, when I started my degree, being part of a student association wasn't on my radar until I was given the opportunity by NAPSA to attend APP 26 on a scholarship, which really opened my eyes to the possibilities that getting involved in more than just the studying and assessment side of university can offer. Immediately, I knew that I wanted to represent pharmacy students and pharmacy as a profession by getting involved with not just members of my university, but professionals and students across Australia. At APP, I realised that pharmacy is all about networking and associating closely with everyone else in pharmacy and other healthcare fields. I wanted to get involved in any way I could, even just to be able to listen to other people's perspectives and experiences. I also recently volunteered for the JCU Open Day, and it was great getting to chat to high school students and even some teachers about pharmacy as a degree and a profession. So many of the students didn't know what a pharmacist actually was or the extensive role they had in all aspects of healthcare. It felt like such an accomplishment having engaged so many people in a conversation about what a future in pharmacy can look like, especially at JCU, where we prioritise rural and remote possibilities across all our health and medical subjects. I'm specifically applying for the Rural Health Chair as I've experienced living, studying and working in remote and rural areas, and want to be able to positively showcase the opportunities that rural pharmacy can offer. Rural health is something close to my heart due to my upbringing, so I feel I would be able to bring a personal insight to this role rather than looking into it as an outsider. I believe this would be beneficial as I could provide a 100% honest opinion on the aspects of living rurally and working or studying in a remote pharmacy. This would assist in the creation of initiatives, as I know firsthand what guidance a rural student would need, but also how important it is for all students across Australia, whether they are studying pharmacy or not, to participate in a rural placement, work experience or other engagement in order to see how vastly different life is compared to a larger urban area. It would also be a privilege to represent Far North Queensland and JCU within NAPSA to demonstrate that amazing things can come from studying remotely, and that if you put yourself out there, you can accomplish great achievements even as someone living rurally. If elected as the Rural Health Chair, I hope to fulfill and exceed the expectations put on me. I also believe that becoming involved with NAPSA and JCUPSA early on in my degree and career allows me to get a head start in becoming a great pharmacist while encouraging other students to do the same. I would take great pride in getting to work closely with rural health professionals, the members of RPA and CPRIA, and of course NAPSA. Attending meetings and events for NAPSA and the Rural Health Committee would not feel like a chore, but an opportunity to learn and grow personally, academically, and professionally. However, if I'm not elected, I still greatly appreciate that I was able to make this application, and I know the members of the board will decide on another excellent candidate to represent rural healthcare. Thank you.